Hi, I'm Marcia, and this is my glaucoma journey channel. I have recently been diagnosed with glaucoma as well as cataracts, and this is a documentary of what it's like to get this diagnosis and the different things I'm going to be trying to eliminate the cataracts totally and alleviate some of the eye pressure in the back of my eye. Um, Currently, I'm on 2 eye drops, and they seem to be working okay. Last time I was in the doctor's office, it was 23 in 1 and 25 in 1, and I think the normal is, like, 21 on the high end, if I'm not mistaken. So I'm learning about all these new things. My mother had glaucoma, and so did my grandmother, so 20% of getting glaucoma is hereditary, and what the doctor told me. So, currently, what one of the things that I'm doing is red light therapy, and I wanted to cover that with some of you that may not are familiar with red light therapy. I just started going about 2 weeks ago, and it's like a tanning bed, but different lights in it. And it's nice and warm. You go in there in a private room and you can disrobe and lay um, full body on the bulbs for 15 minutes. And they suggest that you do it 3 to 5 times a week in the beginning for the first, I think it said 4 weeks. And then after that, it's like 3 times a week. So I evidently it helps build up in your body, maybe. I'm not really totally sure on all the, uh, studies in that, but I do have some notes over here that I'll be looking at to tell you about. It's that the red light therapy, it's also called photobiomodulation, and it's a specific wavelength of lights, often red or near infrared, that gently stimulates your cells. So, it's not red that when you see the light, it's a clear light, but I guess the wavelength is considered a red wavelength. Now, I used to go to this, exercise place, um, what was it called? Planet Fitness, and they had one. They didn't know how many nanograms or whatever, they didn't know that much about their equipment, but, you pay one price, I think it's like $25 a month, and you can go unlimited in their, one, but you have to stand up. It's not a lay down one, and I didn't like that for 15 minutes, and then it jiggles your feet. It's kinda cool. It's kinda cool, but I didn't know if I asked them about what the wavelengths were for theirs, and they had no idea. So I'm going to a private tanning salon, and they have the professional beds that you lay down, and it's only $39 a month. So that's unlimited use that I can go every day if I want. So I thought that was very reasonable, and just a drive across town, and gets me out and gets me going. So let's see. There is science connected with this, and you have to do your own research too. Check it out, especially if you're in a city that offers red light. I'm in a small coastal town in Oregon, and we have like the Planet Fitness one and this other one. So there's probably others there. So I'm sure you have one in your town that you can talk to them about, and talk to your doctor too, because this is all, um, I don't think it would interfere with any medications or anything like that. But it's always safe to let them know what you're doing. It says that on the cellular general health benefits of red light, that it improves the mitochondrial function, increasing ATP, the energy cells use to repair and function. So it's repairing it's not anything that can hurt you, and maybe something else is going along in your body that, or my body that I'm thinking, well, I'll get repaired along the way with getting my eyes. So at first I wore eye protection, but then they said you don't need to wear eye protection. You just keep your eyes closed. And because it's really bright light and it's really warm, it feels really good. And then it helps with inflammation and healing, supports healing of muscles. And I know that the glaucoma is like eye pressure in the back of your eyes. So in my mind, I'm thinking maybe that's inflammation. So the place where it leaks out through the retina in your eye is getting squished, and that's squishing the eye pressure squishes on that nerve that comes to your retinal nerve or whatever. So it shows that red light can stimulate collagen production, improving skin texture and appearance in aging skin. So there's an added benefit. Get rid of some of our wrinkles, maybe. Um, can help in some kinds of chronic pain and inflammation by affecting circulation and cell signaling. So that there's the inflammation and pain. And then it says studies say about eye health, aging vision support. Some research, including studies in adults over 40, found that brief exposure to around 670 nanometer red light in the morning improved color contrast vision by about 17%. So that would be good, kind of good too. And let's see, early lab and clinical research suggests that red light may help reduce oxidative stress in retinal cells and support cellular function, which could be beneficial for retinal health over time. So, that's always a good thing as well. And it's easy, it's not painful. You don't turn red. It's different than, it looks a lot like a tanning bed, but it's different wavelengths there. Dry macular degeneration findings in dry AMD. Some clinical studies showed vision improvement and slower progression in treated eyes compared to control. Through this is a specific condition and device, not an everyday home treatment for everyone. So your doctor may even have red light in his office or her office that you can ask them about. Some doctors have that there, and then you can just take a treatment there too, as well. So I bought a home. My daughter is a biofeedback technician, and when she gives me treatments, we just got a new thing that fits over your eye for the biofeedback. We're going to see how that helps. But we did get a red light. So it's a smaller one. It's not a full body bed that you lay in, but it is a red light therapy home edition. And, I can use it on my knees or, your back or whatever's hurting you at the time, if anything, and just help heal. Put it on your gut. Maybe the mitochondrial, and that will help too. It says that research is still emerging, so they're still looking at the red light as far as for the eye health. And if you are thinking about a device for your eyes, talk with your ophthalmologist first, especially for sensitive tissues like the retina. So yeah, it's always good to include your doctor in any decisions that you're going to make about your eye health. You can sprinkle in something like, let's see, yeah. Research is promising in some areas, especially general health and aging vision, but it's still early for eye disease treatment specifically. So that's what I'm looking at. What I asked ChatGPT to help me out on finding some information about the red light. And because I got this brochure from the red light therapy place that I attend, and in it it said, didn't really mention anything about glaucoma, but it did say that the cellular and inflammation in that it helps and it penetrates the skin, so it can't hurt. As as far as I was concerned, I've been through worse things. So I've started using that red light therapy because my daughter had used it a couple of years ago and she really liked it and was encouraging me, but I never did go until I got this diagnosis. And then I started putting two and two together and thinking, well, this can't hurt. So if it helps the mitochondria, maybe, and it helps the retina. So we'll see, and the inflammation and all that. So I'm hoping that my next eye doctor appointment, it'll show some kind of improvement, maybe, possibly. But I'll keep you posted and keep up on what's going on. My next appointment is in January, where I go with the see a surgeon to talk about different options along the road. Because I guess if your eye pressure is like mine, the 23 and 25, and it doesn't spike too much, that you have like 15 years before you're blind. So it goes down from there. Like if it's 28, it lowers it, according to one doctor that was on YouTube University. So there's a lot of information out there, and for one person to watch it all is a challenge. So if you have anything that has worked for you, that, maybe, I know the vitamin D and the vitamin C are really important in there, taurine. And so maybe next video will cover the supplements that this Dr. Artist says will dissolve the cataracts. So, or he didn't say dissolve, he just said you don't need cataract surgery. What you need is supplements. So we'll see how that goes. So, and he claimed that even in as short a period as 2 weeks, taking these supplements, that you could see an improved difference. So, and there's 3 different kinds of cataracts. So I'm not sure what kind I have yet. So I got all my records, but they're like in code. So it's hard to decipher what they're saying. Chat GPT, I put some of the codes in there and it was able to understand it and explain it to me a little bit. So that was kind of comforting to know that. So anyway, this is getting longer than I expected. And thank you so much for joining me. And please leave a comment or let me know any ideas you have, or if you'd like to connect, and I'll figure out how to look at the comments and how to reply. Like I say, I'm brand new, so this is only my second video, and we'll hopefully get better and better as we go along on this journey together. So thank you so much again for joining me, and I'll see you on my next video. Thank you. Bye.